Good morning students. Welcome to Adarsh Vidyalaya Medication online class. In today's session we are discussing about reproductive health and strategies as well as gain knowledge on personal and social hygiene. First, reproductive health. The reproductive health simply refers to the healthy reproductive organs and its functions. But according to World Health Organization, the reproductive health means a total well-being in all aspects of reproduction. That is, ability to produce and regulate fertility, women's ability to undergo pregnancy and safe childbirth, maternal and infant survival and well-being. Our government undertaken several measures to improve the reproductive health of the people by launching national health programs such as Family Welfare Program, Reproductive and Child Health Care Program. The salient features of Family Welfare Program are maternal and child health care. Maternal means mother and child health care. Vaccinating mothers, infants and children against pathogenic diseases, providing nutritional supplement to pregnant women and children, educating couples about contraception and to have small family norms which improve economic status, living status and the quality of life. We know if there is more children in a family, the cost of living also will be increased. So, contraception with health education is provided to the couple in order to lead a happy and healthy life with one or two children. These are the four salient features of Family Welfare Program. Mother and child health care, providing vaccination, providing nutritional supplement and health education. Then the salient features of reproductive and child health care program. It is an integrated all services which include pregnancy and childbirth, take care of mother and child after birth, that is the postnatal care of the mother and child, and create awareness about the importance of breastfeeding, prevention of reproductive tract infections and sexually transmitted diseases. Next, population explosion and family planning. Population explosion is defined as the sudden and rapid rise in the size of population, especially human population. The population explosion affects the overall development of a country. Our government of India has taken several measures to check population and introduced family planning methods. India has been one of the first countries in the world to launch the nationwide family planning program in the year 1952. What is family planning? Family planning is the ability of couples or parents to attain to have the desired number of children or ability to limiting the size of their families as well as spacing between their children through birth control. So, family planning is the ability of couples to attain their desired number of children. There are various family planning methods. Let us see. First, contraception. Contraception is one of the best birth control measures. A number of techniques or methods have been developed to prevent pregnancies in women. Contraception is the best birth control measure? There are different methods, contraceptive methods used to prevent pregnancy. They are barrier methods, hormonal methods, intrauterine devices, surgical methods. In barrier method, the male gamete sperms are not allowed to reach to eggs. The condoms and cervical caps on vagina are examples for barriers. These devices prevents the meeting of sperms and ovum. These barriers also protect against sexually transmitted diseases such as syphilis and AIDS, etc. The hormonal methods are in the form of pills or tablets. These pills or tablets are taken orally only by females. They alter the hormonal changes of the body and prevent the releasing of eggs, that is the ovulation process. So, when the females taking these pills or tablets orally, they altering their hormonal changes and preventing the ovulation process. Another method is placing a contraceptive device called copper T and Lippis loop by the doctors or by the trainers inside the uterus. This copper T prevents the implantation of the fertilized egg in the uterus. These devices can remain for about 3 years period. These devices reducing the sperm fertilizing capacity and preventing implantation. This also helps to give adequate time interval between pregnancies. Then the surgical methods which prevents pregnancy are vasectomy and tubectomy. Vasectomy is the method of permanent birth control in male in which the part of the vas deferens is removed and ligations are performed. Tubectomy is the method of permanent birth control in female. Here, a portion of fallopian tube, that is the oviduct, is cut off and the cut ends are ligated to prevent fertilization. So, these are the methods of permanent birth control. Next, urinary tract infection. What is urinary tract infection? It is an infection in any part of our urinary system. Women are affecting more than the men. These urinary tract infections are due to bacteria which are present on our skin, rectum or vagina. This will enter the urethra. Afterwards it enters moving upwards in the urinary system. The types of urinary tract infections are cystitis or bladder infection, kidney infection, asymptomatic bacteriuria. Cystitis or bladder infection. Here the bacteria is lodged in the urinary bladder, multiply there and causing inflammation. It is most common in the age group of 20 to 50. Kidney infection. The bacteria can travel from the urinary bladder and upward to ureter and affect one or both the kidneys. It also infects the bloodstream and leads to serious life-threatening complications. Asymptomatic bacteriuria, in which the bacteria present in the urinary bladder which may not show any symptoms. Personal hygiene. Hygiene is the practice of healthy living and personal cleanliness. How should we maintain body hygiene? we all well know. Washing is an important to all age group of people which maintains our personal hygiene. We should take bath daily twice to keep skin clean and free from germs. Hair also should be kept clean by frequent washing. Then we should rinse our mouth. Our mouthwash should be done after every meal. We should wash our hands many times during the day. The towels which are used to dry our hands or body after bathing should be washed and dried under sunlight after every use. Then the clothes, handkerchiefs, undergarments, socks should be washed daily. Washing prevents the body odor, infections and skin irritation. Toilet hygiene. The toilet has a lot to do with personal hygiene and general health, as it is a place that cannot be avoided and used regularly. The parents should guide and practice their children on how to use the toilets at home, in schools and other public places, so that it will protect the children from various pathogenic contagious infections and diseases. We should follow certain measures to ensure toilet hygiene. The floor of the toilet should be maintained clean and dry. This helps to reduce the bad odor and also infection. Toilet flush handles, doorknobs, faucets, paper towel dispensers, light switches and walls also should be cleaned with disinfectants to kill harmful germs and bacteria. Hands should be washed thoroughly with soap before and after toilet use. Menstrual and napkin hygiene. Women's health depends upon the level of cleanliness to keep them free from skin and genitourinary tract infection. Menstrual hygiene. Maintaining menstrual hygiene is important for overall health of the women. The basic menstrual hygiene ways are: sanitary pads should be changed regularly to avoid infections due to microbes from vagina and sweat from genitals. Use of warm water to clean genitals helps to get rid of menstrual cramps. Wearing loose clothing rather than tight-fitting clothes will ensure the airflow around the genitals and prevent sweating. At last, napkin hygiene. Girls should be educated and create awareness among the girls to disposing properly the used napkins. The sanitary pad and tampons should be wrapped properly and discarded because they can spread infections. Sanitary pad or tampon should not be flushed down the toilet. Napkin incinerators are to be used properly for disposal of used napkins. So children, in today's session, we have learned about the reproductive health. Our government undertaken many measures to improve the reproductive health of the people by launching national health programs such as Family Welfare Program, Reproductive Health. That salient features we have learned. Then we learned about population explosion. Population explosion is nothing but the sudden and rapid rise in the size of population. Then we have learned about the birth control methods. Contraception is one of the best birth control measure. The common contraceptive methods used to prevent pregnancy are barrier methods, hormonal methods, intrauterine devices, surgical methods. Then we learned about urinary tract infection. That urinary tract infection is mainly caused due to bacteria which are present on skin, rectum or vagina. There are three types of urinary tract infections. They are cystitis, kidney infection, asymptomatic bacteriuria. At last we have learned about personal hygiene. The main aspects of hygiene are body hygiene, food hygiene, sanitary hygiene and hygienic environment. We learned how to maintain our body hygiene, toilet hygiene, menstrual and napkin hygiene. Thank you.